Hi, I'm Dorothy Seldura, a fourth-year Nutrition and Dietetics student from Cebu Doctors University. Today, I will be preparing the second batch of the Blenderized feeding for the long-term recommendation of our CKD stage 3 patient who also has comorbidities with hypertension and diabetes mellitus. In this diet, it is a therapeutic diet wherein we provide the lesser amounts of electrolytes, considering that his condition is already severe for his kidney function. We don't want to overload his kidney with the potassium, calcium, magnesium, phosphorus, as well as the sodium. So this diet is also low in sodium, around 2 grams or 2,300 milligrams of sodium only, as well as cholesterol only 200 milligrams as well. In this diet, we emphasize the fat exchange as MUFA and PUFA. So we're using olive oil. And then for the flakes and brine, which is the protein exchange, we're using the tuna in vegetable oil brine, the light version compared to the regular one, which is very high in sodium. So we pick the lesser sodium, low sodium option. As for the vegetable exchange, I am gonna prepare steamed sayote. The reason why we use this and the reason why I steam it, because we don't want to waste the nutrients when boiling it. So steaming is a better alternative in really keeping those nutrients in and allowing it to still be cooked in the right temperatures. So I will cut this up and I will steam it. And the reason also why we use a lighter colored vegetable is because we also have to control the oxalate content of this diet. Vegetables with a lighter hue, or actually vegetables that are, if possible, not green, like for example the squash, can also be used in this diet. But in my batch, I'm using this sayote. For the rice exchange, I will be using white sliced bread or pan americano, 10 slices, but I will remove the crust so it's easier to blend for this tube feeding. And for the milk, it's a low fat milk in 250 ml or about 1 glass exchange. So once that's all done and prepared, I will be blending it ready for the enteral feeding. So now I'm moving on to the actual preparation.
I'm already done doing proper hand washing as well as preparing the vegetable by washing it with soapy water. And my table is already pre-sanitized and wiped, as well as all my utensils. And I also have to complete my PPE with this mouth shield. So if I'm ready for that, then I'll start with preparing my vegetables by first peeling it in an assigned container for the waste. And here we go. Since I'm just preparing the sayote in this clip, I figured I'd just give a short nutritional fact from the USDA Food Data Central. According to this database, it says that 100 grams of sayote has 1.7 grams of total dietary fiber, which is very good for heart health as well as for gut health because it serves as cleaning mechanisms for our body. Dietary fiber also feeds your gut bacteria, and fermentable fiber also forms short-chain fatty acids which nourish the colon wall. And now I'm done.
So I'm already done preparing the sayote, and the steamer is already heated, and I'll steam this for 10 to 15 minutes or when it is soft enough and all cooked.
While the sayote is still steaming in the kitchen, I'm going ahead and preparing the low sodium tuna and brine for the protein exchange, and I made sure to clean the can and wash it before using because you don't want any cross-contamination. Also, I am using food-grade gloves because this is a ready-to-eat dish, so we have to make sure that we are microbiologically safe here in the preparation. And I am transferring it in different containers so it's easier to measure. So we add that in the blender, and we add 4 teaspoons of olive oil. I will be putting the milk in later. So I'm now cutting the crust from the white bread just to ensure that our mixture is not lumpy, because this can be a bit tough at times. So the bread is our carbohydrate exchange in this preparation. So the sayote is now ready. I put it in for about 10 to 15 minutes until it's soft enough, and I actually tasted it to make sure that it's cooked. Going back to the preparation area, since all my ingredients are ready, it's now time to just measure and add it in the blender and blend. But of course, again, I added a new set of gloves because, again, these are already cooked food and ready to serve. So I am measuring a cup of sayote and just blending all the moist or wet ingredients in, so it's easier for the bread to mix later. So that's what I'm doing. So I'm alternating it just to ensure that it's blended first before. I don't want to overload my blender. So you can see I added milk, and then I'm gonna add bread again, and then the milk, so it just gets mixed better. So this is what it looks like when it's done, and the consistency should be flowy enough to pass a 3mm NGT. So that's why it shouldn't be too sticky or clumpy, because that might cause that the mixture won't pass through the tube, and that won't be effective enteral feeding. Right now I'm just straining it through a mesh sieve, just to ensure that there are no added clumps in the mixture. Just that this is just an additional step to ensuring that our formula is effective in really being able to pass through the tube without causing any aspiration or cloggings. I'm just finishing the straining for the whole mixture and transferring it to measuring cup, so I know the total volume of this enteral feeding mix.
So I'm done straining the blenderized feeding, and it produced about 650 ml of the formula. So I added cling wrap, and then this will be stored in a cool compartment, such as the refrigerator, before serving it to patients or when necessary. And we're done. Thank you.